Okay, we're getting ready to start the June 12th meeting of the Statewide FSS Council. You'll see some slides on the screen. These are new from our Stakeholder Engagement Group subcommittee. They put together some slides of some of the members. You'll also notice there are open positions. If you're interested in joining your local FSS council, there will be information on the screen, and we'd love to hear from you. We'll get started as soon as the slideshow concludes. Oh, I don't know. I didn't just have it.
She said.
Excuse me, Gail, if you're talking, we can't hear you.
All right, thank you so much, Deb. Let's start out with roll call in Albany. I'm Gail Cato, one of the co-chairs of the Family Support Services Advisory Council. And I would also like to do roll call for the others present. That would be Jan Fitzgerald, Mary McGuire Weaver. Here. Okay, let's go over to our Buffalo location. Chris Guida. Chris, are you up there? You're muted if you are.
Scott's
Try again.
I'm here.
Excellent, thank you, Chris. How about Karen Eichenserver?
Yes, present.
Thank you. Ann Scherf,
Present.
Crystal Bossler.
I'm here.
All right, now over to New York City, Deborah Greif.
I'm here.
All right, welcome. We have a few members that were unable to join us in person, but did get permission to join us virtually, and that's our other co-chair, Kathy Nowak.
Good morning.
Good morning. Mary Fasano,
Good morning.
Tina Vale,
I don't think Tina's on yet.
okay. She will be joining us later, I believe. Scott Brady is unable to join us today. Also wondering if we have Aaliyah Hussein.
Gail, we have Maria here too, virtually.
Maria Suki Kozak.
Here, good morning.
Good morning, Maria. And Jennifer Goldman. Thank you very much. We're going to get started. Let's go ahead and identify those from OPWDD that are in the room and have joined us today. We'll start with.
Good morning, this is Alexis Harrington, Associate Commissioner for Service Access and Program Implementation.
Hi, good morning. Good morning, everybody. My name is I'm the Deputy Commissioner for the Division of Service Access, Program Implementation, and Stakeholder Supports.
Morning, everyone. Erin Peterson, Associate Commissioner for Service Access Program Implementation, Stakeholders.
Can you turn it on?
We're having trouble hearing.
Morning, everyone. This is Carrie, my fellow Commissioner at OPWDD.
Good morning, that's the Division Director of Strategic Planning and Engagement at OPWDD.
Hello, Amy Burdick, Assistant Statewide Coordinator FSS.
Hi, this is Nick Hobson, statewide coordinator for.
Good morning, Chad Colarusso, Director of Family Supports.
Hi, it's Eileen Hayes, General Counsel. Wonderful. Thank you so much, everyone. How about those out virtually that are representing OPWDD that joined us today?
It looks like we've got Meg on from Counsel. Meg, do you want to introduce yourself?
Hey everyone, my name is Meg Vijayan. I am stepping in for Mary Beth Babcock. I'm serving as acting deputy counsel for the Policy and Regulatory Affairs Bureau since she has retired.
Thanks, Meg. And Josh?
Good morning, I'm Josh Olson. I'm the Deputy General Counsel.
Thank you. And Deb?
Hi, I'm Deb Ellis. I'm the Chief of Staff.
And Christine?
Good morning. It's Christine Carey, Associate Commissioner for the Division of Fiscal Policy and Management.
Good morning. That's all on OPWDD virtually. Thank you.
All right, wonderful. We have an agenda today that should be coming up on the screen shortly. We do have some things that may take a little bit longer, so we're going to be a little fluid with today's time, so we make sure that we cover the most important priorities and highlights. We're going to start with Commissioner Holiday.
Morning, everyone. I'll spend a little bit of time this morning going over the enacted budget. I know many of you have had the opportunity to hear about the enacted budget updates, but probably not everybody, and we have not met since the budget was enacted. So I'll go over it in high level and then happy to answer any questions that folks have. Before I jump in, I just want to remind folks that this is my last meeting with FSS. I'll be leaving the agency at the end of June. I think I've had the opportunity to talk with many of you since I made my announcement at the end of March, and I have really appreciated everybody's generosity with me. The best part of my job really is working with the people that we serve and their families and their circles of support. So I've been really honored, and it's really been my privilege to serve as the commissioner. And just want to thank you guys for your partnership and everything that we have done together. And also, want to make sure that there is all assurances that this will be a very smooth transition. I think folks know that the plan is for our Executive Deputy Commissioner Willow Bear to become the acting commissioner. Many of you have had the chance to work with Willow over several years. She's worn many different hats at OPWDD. We're very lucky to be in the position to make a smooth transition. And then obviously you will continue to have the best team working with you, the FSS, SPS team. So none of that will change. So thank you very much for your partnership, and I will jump into my updates. Like I said, by now many of you have heard the details here, but the fiscal year 2025 budget grows OPWDD's spending by roughly $429 million. which brings us up to $5.2 billion as an agency budget, which is a 9% increase. Many of you know that the $5.2 billion is our state dollars. We match the majority of that with Medicaid, so it really brings our agency spending closer to $10 billion when you look at it as the totality of our budget, which is a very big budget. This year's budget in particular provides an additional $89 million to provide a 2.84% cost of living adjustment. This builds on the previous 2 years worth of cost of living adjustments and brings us up to close to $1.1 billion through the 3 consecutive cost of living adjustments. The difference about this year's COLA is that provider agencies are required to spend at least 1.7% of that on eligible staff to increase the staff salaries by at least 1.7%. Which is a recognition of the fact that agencies do have inflationary costs to deal with, but that also, staff wages are of huge and utmost importance right now as we're looking to address and continue to impact the workforce crisis. Additionally, in this year's budget, there's $79 million available to rebase OPWDD's service rates. We do this as a requirement by the federal government every so many years, and this year's increase will help us to recognize more accurate provider cost experience, update our cost data to be more relevant, more recent. It's $79 million available in this year's budget, which when you match that with the federal and local shares, is closer to $270 million. And that, again, that's for just this year's budget. So this is implemented on July 1 of this year. So we're very excited to have the opportunity to invest so much additional funding into the provider rates, which we know will be passed on in quality of service to people that are being served. This year's budget also includes $45 million for providers to help keep pace with the cost of minimum wage. It includes $6.7 million to support New York's commitment to becoming an employment first state, which is something that we're very excited about. It's something that we're implementing with the Chief Disability Officer as well as several other state agencies to continue to emphasize the abilities of people that we serve and to recognize that most people want to have meaningful and gainful employment within their communities, and that we as a system can continue to be able to support those goals for people. So the $6.7 million will likely go out in the form of grants to disability service providers to continue to help put this mission forward. And it also complements very well a lot of the work that we've been doing as an agency over the last several years to continue to build our employment and training programs, as well as the work we've been doing to educate businesses in the community about the benefits of inclusive employment. So we're very excited to continue to build on that with the support of the governor and the Chief Disability Officer. Another budget action was the addition of $3 million to our budget to fund home enabling supports as an assistive technology. Last October, we received approval in our waiver amendment to use Medicaid dollars for home enabling supports. And we're very excited about this because these funds are designed to really help support people to live independently at home and then avoid the need wherever possible for certified residential opportunities. We have seen some of our providers in New York State and lots of providers outside of the state doing very cool things with technology to support independence. And we're really excited to be able to bring that into New York in a scalable way through the Medicaid program. We're working now on procurement, and so you should expect to hear more from us in the coming weeks on this. And we're hoping, to be able to roll this out, sometime this year. This year's budget also includes an additional $15 million to develop supportive housing so that it continues to support our integrated supportive housing program. Since 2016, we've invested a total of $140 million into the integrated supportive housing program. It's one that we're very proud of. And this year's budget also provides $60 million to invest in new service opportunities. Every year we have the opportunity to continue to invest in our system and make sure that it grows to meet the changing needs of folks. People who are entering our system for the first time, people whose needs are changing, and to continue, to meet the changing needs of our system. This year, We have committed again to increasing our housing subsidies to mirror fair market rent. We have additional costs that are associated with people who are aging out of their educational programs. We're opening a new specialty hospital in the Hudson Valley. And we're looking to update property and transportation costs. These are all examples of ways that we spend the new service dollars to continue to meet the needs of our system. And we're excited to be able to continue to support Special Olympics New York with an additional $1 million in their annual funding appropriation. And we know that many of you and your family members have been served by Special Olympics New York and know the value there. A few other updates from me before I close. We have been on the road the last couple months doing our strategic planning forums. We've seen many of you there and appreciate your attendance and appreciate your support. Hopefully, if you haven't had the chance to be at one yet, you'll be able to meet us at one of our next two in person, which will be in Rockland County next week. And then the first week of July, we'll be in the Bronx. After that, later on in July, we'll be offering 2 virtual forums as well. So there are still 4 more opportunities, 2 in person and 2 virtual to attend. If you can't attend in person or virtually, we do have through our website an opportunity to provide your feedback on the strategic plan. As we've been talking about for the last couple of years, our strategic plan really is shaped by the input of the folks that we serve and their loved ones and our providers. So your input is really valuable in helping us to continue to craft our strategic agenda. This year, at our strategic forums, we added a new question and answer format, which we think has gone really well. Our forums have tended to be OPWGD making a presentation and then having an open public comment period without a lot of dialogue or sort of bi-directional interaction. And we wanted to provide interaction. So we implemented a question and answer format. And so if you'll be attending any of the 4 remaining forums, there is an opportunity to submit a question and hopefully it will have an opportunity to answer it at one of those forums. We have been hard at work, as always, continuing to support our direct support workforce and address the workforce challenges. So just 2 things I wanted to share that we're very excited about. I've reported to you guys before about our work with the National Alliance for Direct Support Professionals, and we're continuing that work. In March of this year, Governor Hochul announced an additional investment of $32 million to continue to support and expand our partnership with SUNY and NADSP. So over the last 18 months, at this point, nearly 2,000 DSPs have received their certification through this opportunity that we've provided. And we're expanding our partnership with SUNY to go from 13 to 21 college campuses. So on 21 college campuses across the state, DSPs are able to earn their certification with NADSP, as well as college credits that they can put towards degrees. We have a whole, companion program where we're working directly with providers as well for DSPs to get certification there. So there's many avenues and many opportunities. And we've recently expanded this opportunity to include our state-operated workforce through a partnership with CSEA. So we're very excited about that. We have the first cohort of state-operated DSPs starting this week, actually. So we're really excited about that, and we've really seen the impact that it has for DSPs and for people that they support. We're also underway with our statewide marketing and recruitment campaign, which launched also in March and is plastered all over the state. So I hope that folks are seeing the banners and the social media and the billboards and the commercials on television. It's been really gratifying, I think, for me, and I can only imagine being a DSP, but to be driving down a highway and to see a huge billboard, showing the work that we do. I hope that feels rewarding to DSPs. And what's been wonderful about it is that we have 225 of our not-for-profits partnering with us and participating in this campaign. And the early data that we're seeing is really promising. So far, we've had 14,000 clicks to provider websites. So that's 14,000 people have interacted with our campaign and gone all the way through to the website and found a provider that they're interested in exploring more, and then clicked onto that provider's website. And we'll be working with the providers to understand what's happening for them once they're getting the traffic. Are people applying? Is it converting into hires? Are they able to retain? And the marketing firm that we're working with is local to the capital region and is really committed to continuing to refine and adjust that marketing campaign as we go, as we see what the data is telling us. So we're very excited about that, and hopefully you guys have seen it as well. And just a quick update on our two assessments that I know we talked a lot about, the self-direction review and the managed care assessment. OPWDD is conducting a thorough review of our self-direction program. That contract was awarded to Guidehouse for that work, and that work is underway. We had a presentation from them yesterday at the DDAP that Gail was able to see. They'll be doing both a thorough deep dive on the program as it currently exists and helping us to update our self-direction manual, and then also making recommendations for improvements for the future of the program so that we can continue our focus on sustainability and equity within the self-direction program. Our managed care assessment, which Guidehouse also conducted under a separate competitive procurement, so way to go Guidehouse, winning all those awards. Our engagement with Guidehouse is concluded there, and we're finalizing the report to be released hopefully very shortly. And that will also come along with a plain language explainer and likely a webinar on the website for folks to be able to really dive into and understand. Wanted to provide a little bit of update on other actions that were inside of the budget that have been hot topics for self-advocates and family members, and there were a lot of questions we fielded on CDPAP, the CDPAP program. We know that a lot of our people that receive services through OPWDD and their families interact with the CDPAP program. And just to clarify that OPWDD has its own FI program and is outside of the DOH program. Our FI program is through to support our self-direction program, and that will remain as it is. It is not, implicated by the legislation that was passed in this year's budget. So we are mindful that people utilize both programs, and we're certainly happy to hear and understand the concerns that people have about the CDPAP program and relay those concerns to our partners at DOH. But as it stands right now, our FI program is not impacted by those changes. I just wanted to make that clarification. So again, I very much appreciate the partnership, and we'll miss working with you guys. But I'll certainly be following along with all of everyone's successes and rooting for you guys from the sidelines. So thank you. Happy to be here.
Thank you, Commissioner Neufeld. On that note, we just wanted to take a moment to recognize that this is your last meeting, and also all of the accolades that you have accumulated over your time with us. You've helped this industry in so many ways. I couldn't list them all, but I'll try a few. You've helped us get some ARPA funds. There have been long-running COLAs for this industry that you've been a part of. There's a lot of work that has been done around health equity. You've had the vision and did the work to help the field of mental health and disabilities collaborate in their efforts to support newly diagnosed, and spent countless hours listening to self-advocates, families, and professionals. Most importantly, you've not just been a leader, but you've truly been an advocate in our field, and it was at a time that we really needed it. So on behalf of the Statewide FSS Council, we just wanted to say thank you and wish you luck and present you with some flowers. Thank you.
No, screen share.
That was very. Beautiful. Thank you guys.
Thank you. All right, we are going to dive into the next topic on our agenda, which is program update information from OPWDD. We're going to start with I believe it's Dick Hobson.
Yeah, I can take it from here. Can everyone hear me all right?
Yeah, just 3 minutes to
How's that?
Yeah.
Always. Can you advance to slide 8? Please? All right, thank you. So I'm going to quickly move through some of this, but as Gail said, there will be other opportunities to go into some of these things, and they're going to pop up again in other places. So don't feel like this may be the only time you hear this part of the presentation. So our first section are some of the FSS committee meeting follow-up. These are items that are things that have been from previous meetings that we're still working on or working toward. This first slide, a lot of this is around support and work being done around the RFP priority setting and our continued efforts on that. In particular, this first bullet is a mention of some of the stopgap measures that have been put into place to assist the local councils with needs in terms of data and assistance from our local regional field offices on that. And what I mean by stopgap is, there's been a few meetings that we've discussed a uniform contract information sharing method, and that still is our long-term goal, and we're still working to make that happen in terms of providing different FSS contract related information. But in the short term, we obviously want to make progress toward issuing RFPs, and obviously our local councils need information to be able to do that. So that's where we've worked between the local councils and the RFOs to make that happen and provide what's needed. And lastly, once that utilization information is confirmed in terms of a comprehensive contract template, that'll be provided to the statewide committee for review and dissemination. And there will be periodic updates to that. Next slide, please. So continuing on the follow-up from the last meetings, we are continuing to gather information around and collaborating with the regional field offices to learn more about annual survey practices, contract reviews, and site visit protocols. We will revisit those guidelines surrounding those areas, and that's in order to make them as transparent as possible and also optimize involvement from local council members. We value their input and obviously want them to be involved in the process, but as I'm sure everyone's heard me say, we want them to look uniform and consistent across the state, and that's what we're working towards and why we're looking at those practices so that things are done in a consistent way as much as possible. And we will be scheduling meetings between now and the next quarterly meeting to discuss and collaborate on those areas. Next slide, please. So this is one part I'm going to go through a little quickly. This is a little bit of some of the work that's been done around updating the allowable, non-allowable lists and the FAQs and background work that we have done to inform the changes that were made, which I will be getting to. Going back to last October, we canvassed family reimbursement providers and agencies to get their feedback. So we took the results that we got from that survey, and they were shared with this committee in March. They were also shared other places along the way, and concerns from that survey from providers were broken into two broad categories: process issues and policy issues. Next slide, please. And just quickly, some of the things that were reported as process issues were things like timeliness of the review of and a decision on requests, guidance, additional training needed around ADM updates and changes, some of the care management specific duties, and what their role is in all of this. Increased provider workload resulting from some of the ADM implementation, and more guidance and instruction around clinical justifications. Next slide. And OPWD has been working to streamline and expedite the decision process. And we have made progress toward a quicker turnaround time, not just from the regional office level and also at the central office level. And in acknowledgement of to decrease provider workload and offer standardization, a couple of things that are in the works as well is making some updates to simplify the family reimbursement tracker and also the instructions. And to develop instructions for the application itself. We've heard those are things that would be helpful to everyone out there, so those are in the works. And lastly, we'll be providing more training to communicate all of these updates and share these things as they're finalized. So in the future, the near future, there will be more training around not just this piece specifically, but also updates that have been made to other ADM documents. Next slide, please. And once again, in terms of that survey feedback that we received from FSS providers, they cited a few of their top areas in terms of things that are on the allowable, non-allowable lists, which once again, we're going to get to in a few slides, but some of the top areas they identified of concern were incontinence items, mobility items, mattress purchase / replacement, tracking and monitoring devices, and replacement and repair of non-Medicaid covered items. Next slide. So in November of the previous year, the committee members offered additional feedback regarding specific non-allowable list items, and included in things that they cited for reconsideration were such as incontinence items, mattress, noise canceling headphones, and items not covered through insurance. So clearly there's some overlap between what the providers are telling us and our statewide committee members. And lastly, based on those collective findings, PWD responded with changes to the guidance, which meaning the allowable, non-allowable list, as well as the frequently asked questions document. Next slide, please. And moving on to some of those family reimbursement ADM updates. As I said, there's been revisions made to the allowable, non-allowable list, allowing for greater flexibility. The provider survey feedback, as well as the statewide committee input, was utilized to make those revisions. The FAQ document also has updates to clarify common concerns and address questions identified by all of our different stakeholder groups. And the updated list and FAQs will be made publicly soon. I would anticipate it should be by the end of the week that it will be available on the website, and we'll make sure to get that link out to everyone, so everyone has it and share it as needed. Next slide. So I'm going to go through updates on the allowable list. Like I said, these are things that are in line with what the updated list is, and once it's available, you'll see that. But just as a quick, so people know some of the changes where that were made.
And Nick, just before you go into more detail, I just want to let everybody know again, this is just a sneak preview of the changes that we were able to make to the allowable list in collaboration with all of the stakeholders in response to the survey feedback that we received, and collaborating very closely with the FSS statewide committee and co-chairs. So today is the sneak preview. We're posting it to the website shortly, and then we will be recording a training for folks to go back and listen to in more detail. So don't worry if you're not able to catch it all today. There will be a more in-depth training to just walk through all of these clarifications. So I just didn't want anyone to frantically be writing down notes while you're speaking next. So thank you.
Oh, no, thank you for that clarification. So yes, please don't write furiously. This will be made available to all. So, museum memberships, we clarified what is meant or what's allowed in terms of that. Skiing was added to the list under recreational activities. Outdoor swings for sensory needs were added, noise canceling ear coverings. Sensory activities were specified more as related to IDD diagnosis. Their ADM sections for respite and camp were clarified and corrected, which are sections G and H respectively in the ADM. Over-the-counter medications as related to IDD diagnosis were added, and replacement repair of prescription eyeglasses and hearing aids, if denied by insurance, were included as well. Next slide. Continuing on the allowable list updates, there was greater clarification made around clothing, specifically due to atypical needs as related to the diagnosis. More detailed guidance around what needs or specific situations would allow for clothing to be funded. Incontinence items related, incontinence related items in the absence of Medicaid or third-party insurance to fund them, or if the quantity is allowed under insurance is exceeded, that's been added, or else said clarified in the allowable list. Mattress box spring purchase replacement once every 2 years as an atypical expense. There's additional clarifying language around that specific item, and we've also moved protective mattress covers to the allowable list to go along with the mattress box spring item allowable. Next slide, please. And some of the updates on the non-allowable side of the list. Bed protectors were moved to the added list, as I just said. Prescription eyeglasses, if the criteria is not met. And I will say with some of the non-allowable things, I should preface this, it's not necessarily that there's new items, it's a lot of either clarifying or making sure it's known that these items could be allowable as long as they meet the circumstances that are spelled out within all that clarifying language. So you're going to see a lot of if criteria on this slide, because it depends on whether or not that criteria is met for the item to be allowed or not. Mattresses, once again, the criteria is unmet. Food as an ongoing routine expense was added to the non-allowable side. There was clarifications around batteries. There's outdoor recreational equipment was added, and that's kind of the flip side of swings. That would be outdoor swing for sensory purposes. That was added to the allowable side of the list. Typical expenses, entries, fees associated with the community-based rec activities were clarified. Clothing as a routine expense, if the criteria is unmet, and the ski lesson equipment, etc., was moved to the allowable list. Next slide, please. And the FAQs, really quickly, some of the changes to that. Number 14, there was clarification provided surrounding requirements for clothing as an allowable list. A lot, and I will also say a lot of the FAQ changes are based on things that were either added or changed within the allowable, not allowable lists. So we did our best to make sure both of those documents line up, because I think a critical thing, both of these documents, is that they do work in tandem in a way. It's important to, when you're looking at what's allowable or not allowable, it's also to your benefit to look at the FAQs as well, because they're, in some cases, there's even more additional language that just, to the best of our ability, clarifies what we're getting at. Number 16, there's more specifics regarding clinical justifications. On 18 and 19, there's more on the definition of care managers, as previously referenced in that document. Number 20, there's more language around respite during caregiver's working hours, which was based on discussion from our previous statewide committee meeting. Now, number 21, there's more definition of clothing as a necessity. Next slide. 22, you'll see clarification regarding self-direction and multiple FSS providers. 23, there's clarification on using multiple FSS providers. 24, clarification on who can provide respite services. And lastly, 25, availability of FSS services to individuals throughout the eligibility and redetermination process. Next slide. I've got a couple more. The last part in the program update section.
Can I back you up for just a moment? We have a question from one of our council members. In the FSS follow-up items, you indicated that there would be some meetings in between our quarterly to work on some things. The question was, is there a timeline for that and who would be involved in those meetings?
Yes, so we'll follow up with you guys offline. There is an internal survey happening right now, due back shortly. So as soon as we get those results back, we will coordinate with you as the co-chairs and just make sure that we have the right people engaged. So not fully baked yet, but we'll keep you posted.
Thank you. Sorry, Nick.
So I got a question in Buffalo. So you're not allowing individuals to go to the zoo, which is something my son could understand, but you're allowing them to go to a museum, which is an environment that he can't handle. Is that correct?
Yeah, so is there any way that we can just get some additional information from you guys once this is posted on the website? I do just want to make sure that we're all looking at the same information, and then if we're unable to address it, let's just schedule a meeting to discuss.
Okay, yeah, because there's no way I would be able to take him to a museum safely, but a zoo, that's something that is a safe environment for him and something he can understand.
Thank you for raising that.
Thank you, Crystal.
I have a question, and if you don't mind, could I back up the commissioner's comments with a quick question?
Okay, Chris?
Great, thanks so much. Commissioner, thanks so much. I really appreciate all of your service, and I'm wishing you the best, of course. And I appreciate you sending sharing that information about the click-through rates, the 14,000 click-throughs. I'm trying to understand that a little bit deeper because I know this is information that the community is really hoping for. I'm wondering if you could remind us about the launch date of the marketing campaign, and if you have some indication or idea of how those 14,000 click-throughs track to goal, and I guess beyond that, wondering how you'll be measuring next steps. Is it completed applications? Is it hires? And is there a timeline for that next important set of data?
Sure, so I'll do my best, Chris, without having a lot of that information at my fingertips. It was large, so it's been, it's been fully operational for just about 2 months, maybe about 2.5 months. In terms of what is lined out in the contract related to goals or metrics, I just don't have that information off the top of my head. Part of the issue, right, in terms of what happens to those clicks is that we're hopefully generating and driving traffic to providers, but it is up to providers to understand, what the conversion rate of those clicks is to hires. We don't obviously control that. We don't know, on an individual basis, that John Smith, came through our More Than Work campaign, clicked through to provider A, and that provider A converted that to a hire, right? That's just not information that we have. We are committed to working with the provider association so that we can, to the best of our ability, understand the success of the campaign. But I think from a marketing perspective, right, success is really determined by the number of views and the number of interactions with what we're putting up. And then we will be working with the provider associations and of course with our own state operations to make sure we're understanding, what's happening with that traffic that's being driven to those websites. So hopefully that answers your questions and, more to come as we engage with providers on them. And we're happy to make sure that we're continuing to provide updates, as that evolves here at FSS and also with our general family stakeholders at our regular bi-monthly meeting with them.
Great, thanks, Carrie.
And you had mentioned about there's going to be clarification on respite as terms of who will be able to provide this service. But I've been hearing about how there's an issue about when the service is allowed. It's my understanding it's not allowed while an individual's parents is working. But I don't think any of you who perhaps made this policy has ever tried to hire staff to work for their individual that would provide respite services that has a profound diagnosis with, say, autism, like my son, who frequently headbutts or needs hand over hand or direct service while toileting. Trying to hire someone out of my own pocket, that's like a $21 pay when I only get paid $15 an hour. So I would implore you to, if this is in fact the case, which is my question, I would implore you to reconsider this, because I, like many other families, have difficulty finding childcare for my child while I'm at work. And it would be incredibly helpful if we were able to have a reimbursement to allow us to have a job to provide for our family and to allow our child to be with someone that we can trust and provide services to make sure that our children are staying safe and having someone. Thank you.
Thank you. Invoking me, this is. Okay, invoking me. Thanks. This is Adina Kindo. I just wanted to address a question that was asked. So respite is specifically for relief to the caregiver when that caregiver is not working, right? There has to be a very clear distinction between childcare and relief to a caregiver that is supporting a loved one with IDU when that caregiver needs to take breaks to do shopping or to engage in sort of day-to-day. We can't be in a position where respite then supplants childcare. And so we try to make that distinction and be very firm and clear about that. So to respond directly to your question, respite would not be able to be provided for a parent that, for the purpose of a parent who is working or needs to go to work.
If I could just quick comment on that. I mean, in my mind, when we talk about the need for respite, it's critically important for family caregivers. It's an incredibly difficult activity to engage in. It's exhausting. It's even traumatizing at times. And so if I'm thinking in terms of respite, respite in my mind would be a break from those activities that are creating those challenges, that exhaustion, that frustration, and that trauma for you, in order that you can then engage in activities that will then reduce that trauma, reduce that stress, reduce all of that, right? So if someone going to work for a couple of hours during respite to earn some money, to be able to put food on the table or clothes or whatever it is that they need because they're struggling, and if that's the best way that they're going to have to reduce their stress in the best way, honestly, for them to engage in activity that's going to serve the goals of FSS, which is, maintaining family unity is certainly one of them. So why would we limit what people can do? Why wouldn't we not give, since it's supposed to be a family driven, why would we not give them the choice of what to engage in while they're receiving respite in order to meet the goals of reducing the stress on the family and maintaining family unity?
And we're at a time where we're having a housing crisis, staffing crisis for group homes. And if we are not encouraging that family unity, supporting families so the individuals can maintain a home, this will inevitably force families to push their child towards that housing. So by putting more restrictions on family support services, reimbursement funds, you are essentially pushing families into moving their individuals into residential, which is a huge crisis at this moment. Is there any way that you could help relieve this?
So thank you guys for your comments. I hope you guys can hear me. It's Alexis from OPWD. So I think this is a really good time to just provide a level set that OPWDD cannot be all things to all people, and we cannot provide support in all of these areas. And so I think what's really important to just highlight is that we have this historical program, Family Support Services, that we've never been able to frame in a way to ensure that we are targeting people that need this reimbursement service the most. And what I mean by that is that we've never been able to successfully do a means test to make sure that we're actually able to give these funds to folks who need them the most, and it is directly related to somebody being disabled, right? So I think we just need to level set that for 1 second and just understand that we absolutely hear everything that's being said right now, but we have some restraints that we have to kind of work through and have a better dialogue about that. There's no, nothing that we're kind of trying to say, oh, you can't access this, we haven't been able to means test this and target folks that really need this service. And it's a limited funded program, right? It's not unlimited funds for everybody. So I also think there are some others in the room who want to add.
We've kind of reached our time limit on this topic, even though there's probably a need for another 2 hours of discussion. I think we need to move to our next speaker. Gail, Kathy.
I would just say on the childcare issue in specific, right, we at the agency do a lot of work with our partner agencies to understand the needs gaps in other systems. So while I support everything that Alexis said, right, and absolutely support that FSS is meant to cover, specific costs related to your loved one's disability, we recognize obviously how important childcare is and how difficult it can be to access competent childcare for children who have disabilities. It's actually a space that Alexis represents the agency and working on with our partner agencies. So if there's desire, from the group to put forward, a better understanding for us of what those challenges are, that's certainly something that we can commit to working with our partner agencies on. But it is not up to OPWDD to set up a shadow childcare system. We just don't have the capacity for that, but have the capacity to engage with other systems.
I think I heard that this would be officially released at the end of the week, and there'll be some conversation and opportunities for dialogue after that occurs. And if you're really interested in becoming a part of the advocacy around these services, there is a subcommittee, which is the reimbursement subcommittee that you can certainly join and become a part of. All right, we're going to head back over to Nick to conclude his presentation. Mary, we're going to be just a little fluid today because we knew that we were going to need a little bit more time on this. And we'll probably be addressing some things that were scheduled for later in the meantime. So we'll just let Nick finish up.
All right, everyone can still hear me okay? Okay. So the last piece I have is around our contract termination amendment process. The FSS statewide committee specifically asked for a little bit more of a clarification overview on how this works. So this is a little bit internal processy, but like I said, they felt it was important for everyone to understand a little bit better how this works, so I'm happy to share. Going back to May of last year, we formalized the process around this, and we shared a template that the regional field office staff use to capture information anytime that there's a contract amendment or termination that is generated from the FSS providers. So that is something that's submitted to central office that we review and track on our end. The reallocation of those funds within a provider's contract amongst their programs is considered an amendment. So essentially, if there's movement of money from one program to another, then that same contract with that provider, that's considered an amendment. Dissolution of the contract itself, that's considered a termination. And those unused funds through that process may be used to support other agency priorities. Next slide, please. My last bit on here, the funds to support new services need to be issued through a formal RFP process. I think everyone's aware of that. So that's where the importance of these reallocated funds is that's, you know, something that when we're recapturing those funds, you know, they need to be put out through a competitive bid process and be utilized. Local councils are informed of any amendments in terms of existing FSS contracts. That template I alluded to specifically mentions, you know, the need for council's involvement in and their input when it comes to these amendments and terminations. So they're made aware and provide any feedback or you know, issues they might see with a provider and OPWDD ultimately making any of these changes. And lastly, OPW reserves the right to terminate any FSS contracts for non-compliance for those which are not meeting contractual obligations. And so there's, you know, there's all of that going on. Like I said, I hope that's helpful information as the statewide committee requested. We do a little bit on that today. Right behind here, so I'm going to move over to Alexis for the next slide.
Thanks, Nick. All right, so this is another long-awaited for update about the RFP. Some next steps and timelines for everybody. So I think you're all aware by now that we have to issue a formal competitive procurement process for the previously broken down 3.5 million. We'll have Fiscal kind of just re-review what that breakdown and allocation is in a few slides. We are scheduling meetings with the statewide council reps to discuss their role in this process. This is really, really important, just related to some deadlines that are in place for any statewide or local council members who will be reviewing the RFPs must have a completed and updated conflict of interest on file by June 30th, or you will be unable to review and score the proposals consistent with our current bylaws in place. And those local councils without the priority needs, you have to finalize those with the regional field office by June 30th, or you might be at risk of not issuing an RFP in that catchment area. So I think that's only a handful of local councils at this point. We have, you know, received some updates that almost all have finalized their priorities, and we are also intending to issue the RFP no later than August of this year. And that's all we've got for our program updates.
Thank you, Alexis.
I have a couple of questions.
We're going to address before we move on in the agenda. Deb has been patiently waiting with her hand up, and then we'll go to Kathy Nowak.
Thank you. These are first, what the commissioners, first thing, I wanted to make sure, because I've had a lot of families are nervous about Or will there be issues with the Article 16 and 28 clinics that do serve our population? That's one. Number two, in reference with respite, when respite was started, it was also used to see that when the parent was the child got off the bus at 2 or 2:30, but the parent couldn't get home till 3:30, the respite worker would take the child off the bus or the van and bring them into the house to watch them until the parent came home. Why is that now all of a sudden not allowed? And I do remember this years ago. I didn't need it, but I know other families who used it, and the families were then able to keep their job. And it is something I wish you would all think and be considerate of. It is a very important thing that when you're trying to work, because you don't want to go on public assistance, because then you could end up being homeless, which is not fair. So please think of another way to work with the families.
So this is Aviva. Deb, I just want to clarify that there's after-school respite programs, right? There's hourly respite programs that can continue to support a child or youth who has completed their educational programming for the day. The specific issue that we were responding to is using respite as a form of childcare, and that cannot happen. But to your point about supporting the youth after school, through after school hourly respite, that is completely possible and allowable under the contract.
I just want to clear something, Abiba. I want you to understand that this was, when I first went up to the statewide, this is what former Commissioner Maul told us what respite was used for. It's not my words, this is what he said years ago. So I hope that we can work something out.
Yeah.
And clarify. Thank you.
Respite is defined in the waiver, right, which is our federal agreement which is our agreement with our federal partners, the Center for Medicaid Services. So we can't redefine the definition of respite here at this meeting. It's very prescriptive and very specific about what it has to be used for. So I understand that there were conversations that certainly predate me, but we're always going to make sure that we're in compliance with the waiver and our existing policies and practices.
Deb, it's Carrie. I'm not sure that I understood the question that you had about the Article 16 and Article 28 limits.
Okay, reason I've been asked by a lot of the parents, but also a lot of the agencies that work with the families, and they keep hearing rumors. I don't know if they're true or not. So what I'm asking is, are there going to be any problems or cutbacks to the Article 16 and 28 clinics that serve our population? So, I mean, like an example, a YI, a Heart Share, an HRC, who have those clinics. Are there any cutbacks? This is what was asked of me to ask.
So Article 28 clinics are supported and overseen by the Department of Health. So I would not be able to answer the question on behalf of the Department of Health. I do know that they made some increases to their clinic rates in the most recent budget. So I would assume that that is a signal of support for clinic rates for people with disabilities in Article 28, but that's a DOH question. And we can try to get more clarity on, what that looks like as it's rolled out. And in terms of the Article 16 clinics, I'm looking at Kevin, he can correct me if I'm wrong, we don't have any intention of cutting Article 16 rates. In fact, we are looking at the Article 16 rates and seeing where we can make positive adjustments to those rates to make sure that services can continue there. So what a provider agency decides to do with its Article 16 clinic, I can't tell you, I can't answer specifically for those providers, but in terms of the way that the state supports the services that are provided there, we're committed to the operation of Article 16s, and like I said, looking at the rate adequacy issue right now.
Only thing I'm going to say is thank you for clarifying And I appreciate if you can also help get the information back. So we know what is correct. I don't want to hear rumors. I want the facts, please.
Understanding of
Thank you.
affiliations plans with the Article 28.
Thank you.
Okay, we had one other question, and that was from Kathy Nowak.
Actually have a couple of questions. If we could go back to the slide where we talk about the contract termination and amendment overview, there's a couple of things there that I'm not sure. And yes, I was one of the people who wanted to know what the steps were, because in the past, the local DDROs didn't have to go and explain anything to central office. But I see that where we have, I think it's on, well, first of all, it says unused, the last bullet, unused funds may be used to support other agency priorities. Yes, that I don't see it here clearly that the councils are involved. And in these two sides, it seems like things are going to be done at the provider level and the DDRO level without consulting or having a conversation with the local councils. For example, on the next slide, 22, there is a bullet there that says local councils are informed of any amendments to existing contracts. Before they're changed, my understanding is that a council, we're supposed to be part of making that decision. Oftentimes, we have found that providers ask for an amendment, and sometimes it's because of them not able to find people. Maybe they don't want to do the service anymore, but the need may still be there. And rather than making those amendments and let those contracts, then that money be able to support the agency in a different priority, maybe the councils want to go out with a full RFP because they know that the need is there. So I just like to clarify how involved we in on terminations and amendments.
Hi, Kathy, it's Alexis. So thank you so much for calling that out. You know that it is so ingrained in our brains that we didn't actually type it out, but that is an automatic part of our process. There is nothing that moves forward related to a termination or an amendment without informing and having a conversation with the local council. So that's always our very first question at central office when things are elevated and vetted by the regional field office is, did you have a conversation with the local council? Were they supportive? So you're absolutely right on. That is happening. We just forgot to include it explicitly. So thank you for flagging that.
Well, I think maybe we should specify that if anything's written to the DDROs that don't have that included, just so that we're all on the same page. Because if I was to look at this and I'm a new DDRO family support coordinator, I'm like, what are you talking about? I don't know what kind of communications you've had with your family support coordinators, but if there are any, please make sure that they know we are very much a part of these decisions.
Absolutely.
And thank you.
Yep, we are in regular and constant communication with them, and they are very aware of that. So it was just our bad for missing that to include on the slide, but that is very much happening.
Thanks. Then when we go to the next slide where we talk about the RFP, 23, I think. Yes. Okay. So we do have, I'm going to jump to where I was supposed to be on the agenda because you answer our question. We do have a number of councils who don't have their priorities finalized yet, but now they see that there is a deadline. And if they don't meet it, then they will not be part of this RFP process. We have a few non-functional councils, and we're wondering how we can, on those particular councils, and I have to say maybe one specifically where we may have an issue, how are we going to determine priority? And who's going to be responsible for reviewing those councils' RFPs. And on top of that question, there are at least, back in September, Kevin Valencius was very kind to give us a RFP allocation by district. We had asked by council, we got it by district. So we have Metro, which is Manhattan and the Bronx, with one allocation. And we have Hudson Valley West and Hudson Valley Westchester as one allocation. And we have Western New York, which is Western South and Western North, with one allocation. They're all separate councils. They all have their own priorities. And we have been requested to ask if Kevin can please break that down to council allocations.
So the fiscal updates are actually next, Kathy, so Kevin will cover that in the next slides.
Perfect. Thank you.
Yep.
I'm done.
All right, we're turning it over to Kevin for fiscal updates.
You guys hear me okay? No? Yes. Okay. Great. You guys can hurt my back. I have to go to chiropractor tonight. It's fine. I'll lead in like I'm some person who's never done this before. So, thank you for having me here today. So I appreciate the lead into the conversation around the RFP allocations. So we're on. So what we want to do is just kind of rehash the high level because, you know, we do have some limitations on the vehicles and the process through which we go through the contracting process. And we'll talk about them in a second as we give you the lowest level of detail that we have the ability to give at least within fiscal, within OPWD as to how contracts and the, you know, additional $3.5 million would be reallocated, or we had discussed the approach, right? So just to recap, we had identified $3.5 million that we would use to reallocate for and re-procure FSS contracts. The funds themselves were based on the percentage of individuals who are living at home, and here's one key element of it, in each DDRO, not within each Family Support Services Council region. That's the level of detail that we have to determine how those folks were, you know, where those folks lived and what percentage of them lived at home. And so we were able to drill down to a slightly lower level of detail, but unfortunately that's as low as we'll be able to go, which I'll get to in a second. You know, so we did provide this level of information to you about not a year ago, about 9 months ago now. And so I know you had requested some additional information. So right now you can see the recap again, you know, about 637,000, 36,000 to RO1, RO2, 483, RO3 is 636, RO4 is 1.3 million, and for RO5, again, 436-ish thousand, which gets us to the 3.5 million. So in terms of the next slide. Thank you. That was a dramatic pause. What we intended. Should get a drum roll. So what we were able to do is break it down by former DDSO, the old school DDSO. Right. So we were able to show you here the regional weights and the dollar of the allocation, right? So it's not sorted by, you know, by DDSO with its companion DDRO, but you can see here that each of the 13 DDSOs add up to, you know, the 3.5 million. And so this is the lowest level of detail that we can provide. One, again, because we don't have the information based on each FSS council of who lives at home. And secondarily to that, when we issue contracts, they're not issued by council, right?
OPWD is issuing them at a regional level. And many RFPs or contracts have multiple services in them, which is why every time, I think when we last did this, we worked with, the FSS coordinators and the providers in the regions a couple of years ago to kind of get an assessment of, we had actually physically go out and survey providers to know what services within each contract were being provided because of the procurement mechanism that we follow today. It doesn't allow us to drill down at a lower level of detail. So this is the best we can do. And I think we had talked before about working with, the RO directors to help to further delineate the larger allocations, right, to each of the FSS councils. And that's something I think that, I don't want to speak for Adiba, but I know that was something that we had talked about to allow that kind of flexibility within the larger allocation. And so this is the lowest level of detail that we have and can provide to you.
Kevin, if you were able to drill it down to how many people living at home, because that's how you initially were able to make these allocations, if I understand correctly. Yes?
Right. Yeah.
So if you knew the counties where each of those councils I just mentioned, couldn't you look at those separate counties and figure out how many people living at home in those particular counties? I mean, we do know the councils represent certain counties. And Westchester, for instance, in Hudson is Westchester. And then you have 3 others, Rockland being one of them. I can't remember the rest. So the 3 counties in the other Hudson Council, which by the way is another story, but how come you can't drill it down by county if you already did it by region?
Yeah, Kathy, this is Aviva. I think there are nuances that will take us quite some time to kind of explain here, but it's a manual process that requires us to kind of back into certain data sets. I don't think that we're going to be able to drill it down to the specific population for each of the councils. But I know in previous allocations, right, councils have looked at what the priorities are, right? And if certain catchment areas have a greater level of priority contracts that they want to put forward, why can't there be sort of a decision made that would then be advanced to the regional field office just to allocate a greater chunk to that council to be able to support those programs?
Well, I have to say, the other thing is the logistics. You're going to have both the Manhattan and the Bronx reviewing the same, which is more work than they normally would because each council looks at their own proposals. But now that they're together, you can't have Bronx look at Bronx and rate it, and then Manhattan look at Manhattan and rate it, and then how do you distribute it? How do you distribute that money when you don't know how much each should be allocated?
Yeah, Kathy, we could separate it because it's going to be based on the provider, right? And we have providers, right, that support specific catchment areas, right? And so the FSS coordinators in concert with the council would be reviewing the proposals for that specific catchment area.
If I can just speak to this, because, I worked in an area that had multiple councils in one district, which is what you're talking about here historically. The council reviews the proposals and rates them, right? You may find the proposals come in, one proposal is great, but what they're asking for far exceeds the contract amount. What gets divvied up by your rating system is a secondary component. So you absolutely, from council, can review and score your proposals that come in for your area. And then holistically looking at what gets awarded within the region, would be a combination of both the councils coming together with the regional field office leadership and prioritizing. That's how it was done historically with, with previous RFPs that have been done. And so I don't think we're deviating much from historical and how this was done, was that the scoring, you don't know what provider's going to put forward and how much money they're going to ask for. You may have a provider that puts forward a proposal and asks for the entire amount. We've had that. Right now, the proposal was worthy, but we wanted also to give other people some money, so we awarded it a partial payment. So we might have changed the milestones or how many people they were going to serve. That's secondary to the scoring if it's a valid proposal. So I think that for you to review your own specific council providers that are going to serve either Manhattan or the Bronx, you can absolutely do that, and then the distribution of the funds comes secondary. Does that make sense?
I think offline we'll have further conversation. I don't know who just spoke.
As I'm Anne Marie Peterson, I oversee the regional field office directors. So we absolutely can have offline discussions and make sure.
Because I don't want to date myself, but I probably have been there longer than you. And downstate, this would never work.
Yeah.
It never did. We never had to work like that. And I would prefer if we could talk more in depth about how this is going to work.
We absolutely can. I know that Nina Gritze works with you down in Region 4, and I'm happy to have conversations with the councils.
Sure. Thank you so much.
I have a quick question in Buffalo. Can you hear me?
We sure can.
Go ahead,
Okay.
Chris.
Great, thanks so much. Yeah, not a question on the utility of the distribution. And it's a question I've asked before. If we have percentages broken down by these 13 breakdowns that we have here, we must have the numbers that were used to generate those percentages. In my mind, having that I don't know, the head count, knowing how many people this represents and having that distribution understood on this level would be extremely helpful to us. So I'm wondering if you can share the actual number of people that's behind these percentages. Thank you.
In the data.
The date, where it comes from.
Yeah, the date that it comes from.
Yeah. What year it was.
The data.
I'm just wondering how many people this represents. You know, a capital district is getting 13.8% of the funding. So is that based on 1,000 people, 10,000 people, 30,000 people? I don't know. Those are incredibly important numbers because that drives the power of what we're doing.
Yeah, we'll see what we can do. Yeah, I didn't do this firsthand, so we'll see what data we have. And this is going to be dated to the question about the date, is what the DATE that I thought you heard. You know, we first broached this about 2 years ago in terms of the allocation. So that information has not been, refreshed because we were, from a fiscal perspective, assuming that, we would have moved forward, to execute this. So we'll share that information, but it's going to be dated.
Yeah, I mean, if you can share the numbers and the date, then we have something to begin to track with and to understand how this is all flowing. It's all important information if we're going to try to, help to lead this program forward. So I appreciate any additional information on the actual head counts that are behind this chart. That would be amazing.
Okay. No, I think we have one quick slide about, hopefully quick, about the, we had talked, I think, a couple meetings ago about some guidance around the $3,000 to spend at each of the council's discretion. So what just want to kind of update you that we have a draft document that's being reviewed internally, but within OPWD, and we'll be sharing that shortly. But as you can see on the screen behind me, it'll talk about that $3,000 reimbursement, those reimbursement funds, and how they're available and what they, how they can be distributed, et cetera, like that at a very
higher level, right? Knowing that each region, each council differs in terms of their priorities. So we'll be working through something and be distributing that, I'm not gonna say in short order, but once the review is complete with an OPWDD, we'll share that for you all too. Review.
So, thank you. Wonderful, long awaited, thank you very much for that. Okay, so next on our agenda, we have updates from council.
So I think Meg is going to take these updates and I'll just turn it over to her.
Hey everyone. So I was brought in on this once Mary Beth retired. So I kind of came through halfway through or even further down the road from that. So please bear that in mind. So council's office, we've received the draft bylaws from most of the districts at this point. I think I've reviewed 8 of those to give context of what we've received. We have had some themes in terms of some inconsistencies between the council, the local council bylaws, and the statewide bylaws. So the goal would be to have the local council bylaws align with mental hygiene law 4143, which is the statute that enacts the family support services as a standing committee for your DDAC, as well as the statewide FSS committee bylaws. So when we're pointing out inconsistencies, we're just pointing them out to make sure that all documentation and authorities align with each other. So we did see some trends with relation to membership criteria and some term limits. I'll just say a lot of the term limits weren't really that far off. It was maybe like a year off when the term limits on statewide is 3. Some of the councils had 2 years. So it has gone through the process of review in council's office. Mary Beth looked at them, I think back in February, and then I looked at them again recently. So they have been marked up with some comments and will be returned to the committees with the feedback from central's office. For any councils that have not submitted their council local bylaws yet, we are asking that those be submitted again by the end of the month to align with some other deadlines that we're presenting here today. And that way we can just make sure those are reviewed, everybody gets everything back, and we can go ahead, finalize them, and move on from that process. Next slide. So these are just some of the terms that we're looking for in the bylaws for a review. These are the minimum terms we're looking for, and these are really kind of the only places that I tried to go in and make sure that the bylaws were aligned. I didn't really mess with anything that was not on this list because we don't need your bylaws to be exactly the same, just aligned in certain areas. So for membership, we're looking for the inclusion of individuals with IDD. We're looking for the inclusion of family members, professionals with interests in IDD, and other people with interests in the care of the IDD population. And this comes directly from the mental hygiene law. So that is why we are asking for alignment in those terms. We are looking for the diverse character need of the local individuals to be represented. And we are looking for 3 members minimum for each local council. Again, I think it was brought up, and I'm sorry, I don't remember who, but it was previously brought up in this meeting that we are looking for conflict of interest statements to be included as a requirement within the bylaws of the council. As previously mentioned, those will need to be signed before participating in the RFP review process. So those are really important. We do need to see language within the bylaws that affirmatively states that any confidential information will remain confidential. When you receive confidential information as part of membership in a local council, we just need to see that that language is in there, and that we need to see language that there will be recusal if a conflict of interest does occur in any of the processes. Next slide. Again, just continuing the terms that should be included. So governance rules, I think most of them I reviewed did have this in there to some degree. So how are your chairperson or co-chairperson going to be elected should be in there. And the term limits, again, 3 years. How would additional officers be elected? And what would be the responsibilities of the members? There were some missing just language surrounding the appointment or election of a statewide committee representative. So we do need to see that in there, and that's a 3-year term. Meetings should be at least quarterly, so it should be stated in the bylaws. And I think everybody did have their meeting minutes requirements and amendment to the bylaws included in there, so I didn't see anything that was missing that. And again, this is all just to align with the statewide bylaws and mental hygiene law requirements. I see a hand up.
Yeah, it's Mary Fasano. I have a, you know, we've all worked very hard to get all these bylaws in place and to conform as we were told we had to. However, as anybody, what do we do in the real world and not in Shangri-La where Albany seems to sit, that councils don't have the number of people in order to do all that we're supposed to be able to do. We don't have people willing to step up and take the place when you have a chairperson. No, I don't want to be chairperson. I don't want this. I don't. How do we function? You know, in the real world, we all have these wonderful plans, and that would be fun. That actually, when we went back to when we started, I know we had 16 or 18, you know, elected members. We don't have that anymore. What do we do? Do bylaws get suspended? Do we just keep, you know, plodding on here?
So
yeah, go ahead.
I fully understand your concern, and I did see that when reviewing that. I did think, again, being new to this, so please remember, new to this, but I did think I saw some reflection of maybe the absence of minimum seats, just because I know some councils don't have a minimum number of 3. So the way that I would suggest would be we wouldn't suspend the bylaws, right? We would put in place the bylaws that are in alignment with the state bylaws and the law, and then we would always strive for compliance with the bylaws. With regards to membership in that, like I understand the circumstances, but you wouldn't want to also suspend other provisions within that bylaws that you can comply with. So I don't know that suspension is the best option there.
Meg, this is Alexis. I can also just reply additionally. So we have the bylaws in place, right? We've got the statewide FSS Council bylaws. That explains what needs to be in place to have a functioning council. So if you do not have enough people to operate a functioning council, it's not a functioning council. So all of what Meg said is right. We want to strive to have bylaws in place, but if you don't have a functioning council, we have to work on recruitment to build out that council. And if that doesn't work, there has to be a conversation about some consolidation of councils, which I do believe has already started to happen kind of naturally. And those conversations are happening at the local level. So, you know, obviously we'll strive to have all functioning councils, but it's just this natural kind of evolution where some are consolidating together. So if the bottom line is, if you do not have enough people for a functioning council, that's correct. It is not functioning. And so those bylaws may or may not be in place, but we'll put them in place when there is an actual functioning council. So I hope
that's functioning according to your definition. You could have.
Well, it's our definition, right, Mary? We came up with these bylaws together. You all voted on them, right? So they're not ours. They're all of they're the OPWD's bylaws, right? You all voted on them and they're in place. Any other questions about that? Sorry, Meg, go ahead and continue.
I'm sorry, just unmuted us here. Just a quick question, and thank you very much for the information and moving the bylaws forward. When should we expect to receive the input from you so that we can begin to think about turning that around?
My understanding is very shortly. I did send them back to Nick, and he indicated that they would be getting back to the councils that submitted them very shortly, so in the next couple days.
Excellent, thank you.
Now, what if a council doesn't have all of these into their bylaws? Would they be no longer considered functioning council?
Do you mean don't have all of the required provisions in the bylaws?
That's correct.
So in that case, what I've done is I've put notations within the bylaws to return to the councils to make amendments to the bylaws. The idea is to just get you into compliance versus just saying you're not a functioning council, because I don't believe that many of them are going to be hard changes to make. But again, I'm new to this.
Jan? Originally, weren't local bylaws optional? And if a council didn't have local bylaws, the state bylaws were what they used as their guidance?
So that might have been what happened before, but what we're going by right now is the statewide FSS council bylaws that are in place. So that has everything that you need to know about the local council bylaws that must be in place. And it's all supported by the statewide council FSS bylaws.
So this is Eileen. Yeah, I think that's right. And really it's important for the local councils to have their own bylaws as well for issues like governance and certainly for the conflict of interest issues and the things that Meg has addressed. But to Meg's point, you know, our goal is to get each of the local councils into a system as much as we can to develop and enact, you know, work bylaws. And so that's what we'll be doing in council's office, and Meg's been really beneficial on that front. And we intend to get those back to you very quickly. And if those, I think there's only councils that haven't sent their bylaws in, if they can get them in by the end of the month, we'll turn them around as quickly as possible.
Does that conclude the presentation?
I have my hand up, Deborah Greif. I would just like one clarification, please, in reference to the bylaws. I was told when it was the OMRDD Family Support Advisory Council that if you've had issues, that you were supposed to follow also the Robert's Rules of Order that gives you instructions on how to set up bylaws and how to work with it. Are you also using the Robert's Rules of Order?
So Robert's Rules of Order is not required to develop these bylaws. The bylaws are really the governing tool. So we're working on developing those bylaws, and each local council wants to incorporate some provisions of Robert's Rules of Orders within their bylaws, and then we can certainly address that. But we're not governed by Robert's Rules of Order.
All right, thank you.
Sorry, I was muted. Just to add to what Eileen said, for those councils that did include provisions that state that they will be following Robert's rules, that was not taken out or anything in the review process. So not all councils did include language specifically stating that they would be following Robert's Rules of Order, but for those that did, I left those untouched.
Those should be reviewed if they don't apply.
Thank
Okay.
you.
Yep. And then the last slide for council's office before I think it's our break, is the statewide FSS committee bylaws and reimbursement ADM RFP. Now, I was actually not brought into this part. I was brought in just to the local council. So Eileen, I don't know if you have, or Josh, if you have anything to say on this slide.
I think we're good, Meg. Thank you so much. This slide is introducing our subcommittees and the next component of the meeting today. So thank you so much. You did an excellent job. Okay, our next point, we're going to move on to hearing about subcommittee priorities and updates. However, I am looking at time and I believe there will be some discussion so that we don't stop the discussion in the middle. If folks are in agreement, why don't we go ahead and deviate a little bit from our schedule and take our break now? And then resume right at 1 o'clock, and we'll start in with our bylaw subcommittee. Okay, thank you, everybody. Welcome back from the break. We're going to pick up and resume with our statewide FSS meeting. We're going to start with our priority areas and updates from subcommittees. We'll start with the bylaws subcommittee. I'll turn that over to Mary Casano.
Let me swallow my cookie first. I don't really have anything to report. You know, we're waiting for the locals to get the comments from Meg, and we'll move on from there. Although I still have a concern of local councils being able to live up to all the aspects of the bylaws because of our reduced numbers. And I don't know, is any other comment from anybody? If not, I think we should just go on.
I do have a note here that we're going to have some discussion. Oops. Some discussion around adjusting the bylaws. That might have to wait until we get the basics underway first. Do you recall any of that discussion, Mary, about making adjustments to the bylaws about removal of non-engaged or non-attending members and adding attendance requirements?
Quite frankly, I'm not sure what you're talking about.
All right, well, then we'll table that and we'll come back.
All right. I'm going to go back to trying to breathe. Okay, take care.
All right, next up we have our reimbursement ADM subcommittee, right?
This is Kathy. Maybe you just want to have a brief discussion about that, because we really did, you know, talk a little bit about it at our last meeting with our member-only meeting. And we could have further discussion later, but maybe talk about what our thinking is for the future.
Okay, would you like to handle that, Kathy, or?
Sure, I will. So we had discussed possibly amending our statewide bylaws because we have thoughts about ourselves as members, a member in good standing, a responsibility of each member to the statewide, such as we have a number of subcommittees. And we were talking about having each statewide member to be active in at least one subcommittee. We talked about attendance. We talked about participation. We're now going to meet monthly on the off months when we don't have our quarterly meeting. And we also talked about something else. It escaped me. Maybe you remember, Gail. So
attendance requirements and removal of non-engaged or non-attending members.
Okay. And we just like a little feedback from our statewide members on your thoughts about this, and if we should have Mary and her very small committee, which needs members, to proceed with this. Anybody raising their hand, because we can't see.
I mean, certainly we can have this discussion. I'm not opposed to any discussion.
Oh, I know. The other thing, I think, Gail, we were talking about possibly, and we weren't sure if we had to amend the statewide, but we were talking about inviting people outside the statewide to participate in the subcommittees, in the subcommittee work only.
Right, I was actually just gonna bring that up with the mention of very small subcommittees, that we did discuss that with OPWDD. It's actually a practice that the DDAC does as well, and that is having local council members join our subcommittees and help out with some of that work. And that is something that is allowed. So anybody that is interested, any subcommittee, local council, regional council members that would like to do some work and work with any of our subcommittees, we would love to hear from you.
And actually, when Chris speaks about the stakeholder engagement later on, you see that statewide email. If you are interested in joining any subcommittee, you could send us your interest through that email.
You know, what about the larger
Yes, I do.
issue? The larger
Sorry, Mary.
issue of, I don't know who's
Wait a
talking.
second. Mary, go ahead.
What about the larger issue of so many councils that are not active? I mean, you know,
Well, Chris will talk about it. We and Gail have made a lot of headway in the last quarter, and they're moving on. So, yeah, we have some good information. We not everybody's functioning, but I see in the chat that one of the members participating today, one of the family members, may be interested in Taconic. Please stick with us. But I have confidence in the stakeholder engagement subcommittee. They've been doing a lot of work, and like I said, we'll hear from them shortly. But it is a concern, or was a concern. Deb?
Yes, first, Mary, I want to thank you because that's really one of the hardest committees to ever do. I've been on bylaw committees. It's very hard. And the concerns you're bringing up are very valid. I think it is important. We have bylaws that are guidelines because we're volunteers. But one issue I just wanted to bring up because I want OPWD to hear this. I get calls from younger parents, or I say a little even younger than Christopher, my son. And the first thing they said, do we get paid to do this? And first of all, my mouth is like this, huh? Okay. And then I quickly pulled myself together. I said, no, we're doing this for volunteer because we want to make sure we keep the system, this OPWDD family support and the other programs intact. But it gets me. That's all they want. And the minute they hear they're not getting paid, I don't see them ever again. And it's something that I wanted to bring up too, because that also makes it rough. That's why some of us stay on longer and longer, because when we try to get the younger parents explain that this is not for us to be paid, we are trying to keep the system intact because of the intense needs of children with developmental disabilities. So I just wanted to bring that issue. That's a big issue that we're having in not just Brooklyn, but probably others too.
I would like to add something to the discussion. I was rather disheartened, to say the least, by the lack of support that I felt from Albany in our struggle to have viable councils. You know, I think they were very quick to say, well, it's non-functioning, rather than to say, let's figure out a way to make this work. I didn't have any positive feeling from what I heard. I hope I'm wrong, but that's how I felt.
So Mary, this is Aviva. I don't think that we were trying to be dismissive in our comments, right? We know that you all have a subcommittee that has prioritized, right, the stakeholder engagement, and we've talked a great deal about how to also make sure that folks are aware of the FSS Council and its role right through the engagements that we have around the front door and certainly our regional field offices. And we've committed to that. I think we were trying to be responsive to the direct question around what do we do if we don't have functioning councils? And we wanted to be responsive to that and say that to the extent that folks need to consolidate in the interim, that's what should happen. And as recruitment and engagement continues, if you have a forum to establish a functioning council, then obviously you can reestablish, right? I think that the bylaws were broad enough where they indicated, I think it's a minimum of 13, right? And again, that was a way to really provide the flexibility that's needed. So it was never intended to be dismissive. We were trying to be responsive to the question that was asked.
The other issue I realized from the agenda that we talked about was the removal of non-engaged, non-attending members. That also applies, I would assume, to the statewide group. Is that a can of worms that we want to open up at this point?
I think that's the can of worms that was proposed for discussion at an upcoming meeting. And then we can decide how to amend our bylaws, who's going to do that and bring it before the council for a vote prior to it going for final review.
All right, so that's on hold for now. Okay, thank you.
Till our next meeting.
Okay.
Any other comments or questions on the bylaws? Okay, we'll move on and check in with our reimbursement committee. The subcommittee chair is Deborah Wright.
Hi. Well, now that we've seen, first of all, Gail, thank you also for going to the DDAC. And what's very important is also that when OPWDD showed the newer allowable list, more explanation, it'll make it easier for us to work to even do more explanation. I did send, I hope you got that email we got from one of our providers who sent about a family whose child has intense needs. And I don't know how to, I don't know how we can't help this family, but I do understand the rules from what OPW is saying about with reimbursement. I know it's not to use as a support, but the one thing I've gotten, and I'm glad they're hearing us. One, we need the guidelines for justification for medical. But the other piece that's very important is they have to understand that for years, reimbursement was done one way. And whether it's an agency, now a care coordination committee, and the families, we're used to doing it one way. We're used to having to be able to replace certain things. I did also send you the list of what the New York City Department of Health does when you have to replace mattresses and stuff. So this is going to be a constant work in progress, and I understand that. So the committee and I will be working, and anybody wants to work with us so we can make more and improve changes, because one big part I've been asked is not to be so draconian, and let's figure out there are times we have to, sometimes in a real emergency, investigate, but bend the rules a teeny bit, because we have children who have such unique needs that we need to work on this. So that's all I'm saying for now. I'm waiting patiently for OPW to put the newer allowable and the non-allowable list up on the website. And then I feel that we can set up a date within a month, we can start working on that. So Gail, I know you do come to that committee and help, and I appreciate it. Is there anything else I missed?
Not that you missed, no. I have one brief report, and we were going to open one piece up for discussion. The brief report was I have spoken with the DDAC's Health and Wellness Committee. it's still being reviewed and considered for their assistance with creating a template for clinical justification. So that is still in the air and on hold. But there's a topic that's come up quite a bit. We've heard about FSS and eligibility for those individuals that choose to work in CDPAP services. And we wanted to bring that topic up because we have had some great conversation with OPWDD about ways that we might be able to make a change in that area. So we had suggested looking at income, if income was the concern. And so we're just going to bring that up for discussion. Does anybody have anything that they wanted to talk about around that? One of our suggestions was that no one's getting rich by providing those services, and that if income was a concern, that maybe we could look at income for eligibility and not just rule out those families. So is there anyone else that would like to comment on that?
I would like to say this. People think that if you have money that you're working, you're not, say, either on public assistance or SSI or SSDI, or you're very wealthy, but many times that's the families that even need even more help because they're the ones their children fall through the cracks. So we do need to look at that, and that's a great topic. The other piece that feels like, well, one, I'm glad that the DDAX committee is going to work on I understand about medical guidelines eligibility. That'll take a little bit because it has to be written a certain way. That piece I understand. But we should look at these different guidelines because many of those families make $2 or $3 above to be able to get SNAP benefits or even Medicaid. And until they get the waiver, it is the hardest thing. So we should look at everything. One thing I just wanted to ask is this. In reference to the self-direction, I keep getting yelled at by families about that. I said, we have to work that out. Number two, foster families have been asking, how come, I know their kids get funding, but why can't they participate in the reimbursement when they need to send their children to camp because they don't get money from even their county for them to go to a camp? That's all I'm asking.
Okay, thank you, Deb. We wanted to encourage discussion around the qualification of those individuals that provide CDPAP services for FSS reimbursement. Was there any other comments or discussion that anyone wanted to chime in on around that? Would anyone be opposed if we were to collaborate with OPWDD to find ways to help those families become eligible for reimbursement?
I'll definitely help. I'm going to see if I can get other families I know to assist. And I'll also talk to some of the professionals too.
Okay, so this is a charge that subcommittee will be bringing up and working on collaboratively with OPWDD moving forward. Did I hear Chris?
Yeah, I've probably said it all before, and I know y'all have heard it from me before, but in my mind, it just, people providing CDPAP service are certainly among the most challenged families in our community. And the idea that we somehow are making disadvantaging in them, I guess, because if they can't find people from outside to provide CDPAP services in the home, that we further disadvantage them by taking away their family reimbursement makes no sense. Again, it just seems to act against the goals of maintaining family unity. And I just have such a hard time trying to understand why we move forward with this policy, especially, if you're a family.
That's the policy we're talking about trying to change, and OPWDD is open to dialogue and collaboration to review that and try to find ways to make it accessible. That was
So who do we talk with directly about that?
You can join the subcommittee for ADM reimbursement, and we'll be working collectively and collaboratively with OPWDD to find a way to try to make this population eligible. That's one of the goals that OPWDD has been open to exploring with us.
Yes, but that's a time-sensitive issue for those families. So I hope the OPWDD realizes that and can move those talks forward much faster
Yeah.
than some other subjects.
Yeah, I mean, we've been talking about this for a
Yeah.
couple of years now,
This
ever
is
since it came out.
critical for those families.
Absolutely. And I mean, I know families, family caregivers who have left careers because they couldn't find help to provide CDPAP services in their home. So if you can find outside help, you still qualify. But if you can't find outside help and you have to further invest in trying to keep your loved ones safe and living at home, we're disadvantaging you in finding ways to resolve this. I mean, yeah, there's a way to resolve it. Modify or amend the ADM and remove that requirement and you're solved.
And do it quickly.
It's easy.
It's not a difficult thing to do.
Thank you.
Yeah, families are struggling. So I encourage any families listening today to perhaps join the Family Reimbursement Subcommittee.
Hi guys, it's Alexis. My microphone isn't working, so I really feel like I'm doing karaoke right now. So I wanted to make sure that everybody heard exactly what Gail said. We are trying to have a conversation about how we can allow paid caregivers to access family reimbursement through FSS. And what was proposed was looking at income. So the question is this a good idea? What I'm hearing people say is this has been an issue, a longstanding issue, and yes, we agree, and that's why we wanted to have a conversation about it. So I think we're all kind of talking past each other. So I wanted to make sure that that was perfectly clear, that we are trying to work together on a solution. So I hear you on time sensitivity, but can I just get confirmation from folks that you understand what we're trying to talk about here as a positive?
Yes, and can we get confirmation that you understand that it's a very time-sensitive issue?
Confirmed, yeah.
Yeah.
Good.
Yeah, I'm just going to put in my 2 cents there. I don't understand how you define them as paid caregivers when they're providing a service that other families could have put in their home if staff existed. And the funding stream is completely outside of OPWDD. The services that they're providing are completely non-duplicative to the services that are provided through FSS. The only difference is they have to stay home and work for minimum wage because the system can't provide staffing in order to meet the services that their loved one is eligible for. It just seems like it's a lot of talking and a lot of time going by when I think the solution, just my input, and I'll leave it, is so obvious. And it's just that criteria is just not appropriate to serve the needs of the community and the goals of the program.
I'd like to add a little bit here too. Consider a catastrophic illness hits the family or the caregiver. That would really, if you're looking at income level, something of that situation might be very, overwhelming, knowing that they're paying for huge medical expenses and trying to push in and provide support while they're taking care of a medical issue with their family.
So just one last thing before we pivot. There's a lot of things that you brought up that are really important and will be great part of the discussion as we go forward to look at solutions. I do think it's important to, with CDPAP, you may not have been able to find an alternative provider besides a family member. That is true, but it's not a requirement. So there are people that use family members as a paid caregiver through CDPAP that haven't been able to find an alternative solution. That's their choice. And that's what they provided to do. I think that it's important to have a conversation. I think we're open to have the conversation. And I think the work group that Gail is organizing, all of these can be part of the conversation.
Okay. Are we ready to move forward? Sounds like the committee is definitely in favor of continuing that conversation and creating some action items around that and having some great collaboration with the WPT. So that will be on the horizon. Please feel free to reach out and join the reimbursement subcommittee if you have an interest in being part of that important work. Next, we want to hear from our RFP subcommittee.
So I think a few of our discussion points were covered under Kevin's presentation. The first bullet, we were going to see if we didn't have all the priorities in, if we could have a regional release RFP, and that's been clarified that everything is due June 30th, and the expectation is the RFP will be sent out sometime in August 2024. And we were looking for those next steps, such as expectations when the RFP will go out. But we do have to, between the time the RFP goes out and it's received, we have to talk more about how this works, the logistics, you know, using computers. Do we have to go to DDROs? Times that the reviews could be done. So we'll be working that over the summer with OPWDD so that we have understanding of our responsibilities once the RFPs are returned.
Kathy, this is Aviva. That is correct. We just wanted to make sure that folks understood the vehicle that would be used, right, to push forward and receive the proposals, but then schedule some meetings in between this meeting and the next quarterly meeting, obviously before the RFP is issued, to talk more specifically about role, responsibility, engagement, scoring, et cetera. So all of the logistics of, you know, issuing and receiving the proposal and scoring will be further discussed with folks in the meetings that we reference.
Can I just ask a question? This is Maria Suchi-Kozak from Westchester.
Go ahead, Maria.
Oh, sorry, I wasn't sure you could hear me. I apologize. So being part of an area where there are several non-functioning councils and being mindful of the timeline that was presented regarding RFPs, I would like to, and this is probably we'll probably have to address this outside of this meeting, but I would like confirmation discussion as to how we need to handle the possibility of having to consolidate, potentially temporarily, because I don't see how, even though we're actively recruiting, I know that that's been ongoing. I don't see how we will be able to meet that timeline. Westchester will, but the other two might not. To have a fully functioning council. So I want to understand how that's going to work. We met with our local people, but I'm not clear on how the process is going to continue if those councils continue to be non-operational at the moment.
Hi, Maria. So yes, I do think we have a little bit of time carved out after this meeting to have an internal kind of dialogue more about that. So I think you're right on track. There might have to be some kind of temporary consolidation to make sure that we're still moving forward with the issuance of the RFPs. So it'll be a long kind of conversation we'll have to work towards for long term of getting those councils in place, but we won't let that kind of impact you guys getting the RFPs out.
I did have a question about that also. If you have one region with multiple councils in it and some of there's say 3 councils, 2 councils have their priorities in, but the other council has nothing. How would that be handled in terms of funding?
Sorry. So I think, again, we want to make sure, right, because you all put forward, I shouldn't say everyone, but folks have put forward their priorities, right, based on the needs of that. And again, I think that we would be issuing the RFPs, right, sort of based on those specific needs. And then to Anne Marie's earlier point, right, understanding when those proposals come in, right, what do folks think they need to be able to provide the specific services or supports, right? And then be able to adjust, again, depending on the number of people that would be supported through a program in a specific region, right? So if you have a third council that hasn't put forward needs, right, then the monies would be allocated between the programs that were included in it.
I would just a quick comment, if I might, in Buffalo regarding councils that don't have enough people to fully participate in the RFP process. Trying to like short-term merge that with another council, while on paper sounds good, it's not a small amount of work to put together those priorities that the way we've been asked to accomplish them. So it's I think maybe not the most reasonable thing to hinge the go forward in those regions of an RFP process on a group of volunteers that's already working their tails off to try to take care of their own group. So I guess my question would be that since we have a lot of data from the survey, I'm sure we have people that would be happy to get in a conversation with the local DDRFOs about their needs and priorities. Can OPW in those two regions where we don't have representation yet, can they develop the list of priorities and maybe have a little review process meeting with an adjacent council or maybe with statewide?
So Chris, this is the thing about, I mean, we can certainly go back and review, but the entire sort of premise of this program and what we've been talking about, right? And I think early on, folks even thought we were trying to sort of remove that ability from the council, right? Has been about the council through conversations with families, right? Really putting forward what you all feel are needs and priorities, right? And we really tried to stay true to that. And so I think we're at a point where we've established a deadline, right, to get the RFPs out. And I think that if there are specific councils that don't have priorities identified because they're not functioning, et cetera, we just have to move forward. We cannot prolong this any further. You know, we're going on, 2+ years. We are going to move on regardless of what priorities have been put forward by the deadline that we've identified, and that would be August.
I understand that, and I understand what you're saying. We appreciate the opportunity to have that kind of input to things. We are set up to advise you, not to run the program, right? So if we have regions that qualify for RFP, but only because we don't have a functional council there, I don't understand how that would preclude you from doing the work of running the program, establishing those priorities based on the data and any other input you need, and then moving forward on the same timeline we're on. It's a lot of work, and it's an awful lot to ask a local council who's already busting their butts to try to get this done, to then take on another whole local council and do it on a tight timeline. It's an awful lot.
Understood.
And I'll leave it there.
Yeah.
Thank you.
The best path forward is for those councils then to do the work of putting forward their priorities in the RFP, and we'll move on from there.
Okay. Anything else on this topic? RFP, clarification of next steps. I think we'll be having some more conversation offline as well.
I just want to bring up one thing that there once or twice in the past with the RFPs, the New York City, we had to do a multi-borough. It's not always easy, but we did work together and get it done. That's my only point I want to bring up. But if you're used to doing RFPs, we can do it. And yes, it's hard work, but it can be done. That's my only comment.
Thank you, Deborah. Colleen, if you wouldn't mind advancing the slide past the break. Our next subcommittee update is from our Advocacy Subcommittee. I'm going to turn it over to Mary McGuire-Weaver.
Hi, everyone. I'm actually addressing for the Advocacy Committee on behalf of our chair, Scott Brady, who's not with us today. So I'd first like to say that we're happy to see that the FSS information was included in the front door online presentation. Thank you, Amy, for doing that. We do see some problems navigating the website though for FSS, and we were hoping that we could collaborate with OPWDD in addressing an easier way to navigate it. Maybe if we could make a menu on the side where you could first see the brochure, the ADM, certain councils, the statewide functions, the great slide that represents all the statewide people, and maybe a directory by region, just some ideas to throw out there for you. And hoping this is something we can work with together. Forward to continuing discussion of that. One of the other big concerns of ours in addressing the needs assessment is knowing the performance of our FSS programs. Many regions have a process for performance review and oversight, have the annual review of the allocation and expenditures, as well as the process for program involvement and corrective action. I myself, my local council is great. We're very transparent, and I am very involved in collaboration with our DDRO. However, I don't think that's happening with all the councils. I think there's still a lot of inequity across the regions, and I think if we had OPWD collaborate with the councils and the DDROs, that we could allow the other statewide reps to have access to transparency, knowing like the contract numbers, following the performance, and having utilization numbers based on the data that the DDRO gets from every provider every quarter. I think this is prohibiting some of the local councils to identify priorities. So we look forward to advanced discussion on how we can collaborate on that note.
Thank you. And just to respond in the room, that was related to all of our updates that Nick had shared. So
I meant to say that, Nick. Sorry, I did write that in the very first slide. We did say, that you were ensuring that local councils have access to data and support. So I didn't mean to say that, sorry.
Thank you. Yeah, no, that's
I wanted to say something.
I appreciate it. And that was the meeting that we were going to be scheduling between our next quarterly and the survey that is being completed right now internally. So.
Okay, I just wanted to give a kudos out to my DDRO.
All right, thank you, Mary. Trying to.
I'll bring the food on back.
And Bree's personally going to deliver that kudo. I'm just trying to take a look to make sure I'm not missing any hands that are raised. We've got a very small screen and a lot going on it. So it looks like we're good to move forward. So our next subcommittee that we're going to hear from is the Stakeholder Engagement Subcommittee. Thank you. Chris Palega?
Unmuting. Sorry, I had to unmute. Hi, everyone. I'm Chris Palega. I represent Region 1 Monroe, and with Crystal Vossler, who is our representative to the southwest of us in Region 1, we became the statewide FSS Stakeholder Engagement Subcommittee about a year ago. One of the first projects we took on was a rebuild of the statewide system of local FSS advisory councils that had fallen into a state of disrepair. Between then and now, we've had at one time or another 6 of what were initially 19 local advisory councils who did not have enough members to conduct the business of helping to support families via FSS. Other councils wanted to increase their membership, but were encountering challenges. So today, what I'd like to do is run through the current advisory council structure in detail, the counties that each one of those serves. That's been a question that's been going around. While doing so, I'll try to highlight some of the changes that represent progress toward our goal of stakeholder engagement, of having a fully functional FSS advisory council in every New York State county by the time we meet again in Q3, something that we have not had for years. I'll talk a little bit about the work that's been done and plans for the near future. Let's start with Region 1. Can I get my slides up, please? Great. So in Region 1, at one point in time during this past year, you'll see Western North and Western South, Crystal's group did not have enough members to be fully functional as a council. They collaborated together, Western North and South, Crystal and Ann collaborated in order to make sure that we had coverage in all counties in that area. Recently, through Crystal's hard work and dedication to the cause, Western South has achieved membership that will allow them to be independent, and they are now acting as an independent council. When we began this work, there were actually 2 Finger Lakes councils in Region 1. One of them did not have sufficient members. And so I want to recognize Karen Eichenschur for stepping up and helping out to try to bring that council underneath their wing. And they are now fully functioning and covering those counties. So let me just read through for people who have dialed in. Region 1, the FSS advisory councils in Region 1 in Western North are Erie, Genesee, Niagara, and Orleans. In Western South, Allegheny, Cattaraugus, and Chautauqua. In Finger Lakes, we have Chemung, Livingston, Ontario, Schuyler, Seneca, Steuben, Wayne, Wyoming, and Yates. And thank again, Karen Eichenschur. In Western South, we have Allegheny, Cattaraugus, and Chautauqua. And in Monroe, it's just Monroe County. Next slide, please. So in Region 2, when we started out this work, Central New York at one point reached a place where we had no members functional in one and only one member in another. Central New York has been kind of the focus of my personal engagement in this effort. I've worked on recruiting based on prospects that we received attached to the needs analysis survey. So we were able to recruit and put in place a council with now 6 members with signed COA documentation. We've been meeting monthly. We are in the process with the help of Gail and her local advisory council in Broome, working on training up, answering questions and getting priorities submitted by the deadline so that CNY has gone from having no functional councils to being able to participate in the current RFP process. So Region 2 FSS advisory councils, we have Broome, which are the counties of Broome, Chenango, Delaware, Otsego, Tioga, and Tompkins, I'm sorry. In Sunmount, we have Clinton, Essex, Franklin, Hamilton, Jefferson, and St. Lawrence. And now in Central New York, we have 2 combined councils into one, covering Cayuga, Portland, Herkimer, Lewis, Madison, Oneida, Onondaga, and Oswego. Could I have the next slide, please? In Region 3, we currently have 2 councils who do not have sufficient members to function. One that I'm calling Hudson Valley West, and the other one is Taconic. I have moved my direct efforts into the recruiting process to the Hudson Valley West area, and I'm actively beginning to reach out recruitment based on the prospects we obtained from the needs analysis survey, and also exploring a couple of other channels to try to accelerate the growth in membership for Hudson Valley West. Like I said, the goal is to have that council fully functioning by the next time we meet, but I'm hopeful that we will accomplish that sooner than that. Taconic is also another council that does not have sufficient membership, so I want to give some thanks out to Scott Brady, who's our statewide rep in Capitol, and also his local advisory council chair, Carolyn Huston. They have taken on some of the work of recruiting members for their adjacent council in Taconic. My understanding is that they have some prospects who have been attending meetings, and I at least don't want to speak for them. I'm hopeful that they'll be able to bring people on board and have a fully functioning council there. So in Region 3, we now have in Capitol the counties of Albany, Fulton, Montgomery, Rensselaer, Saratoga, Schenectady, Schoharie, Warren, and Washington. At Taconic, we have Columbia, Dutchess, Greene, Putnam, and Ulster. In Hudson Valley West, we have Orange, Rockland, and Sullivan. And in the other Hudson Valley, we have Westchester. Could I have the next slide, please? Region 4 has been a membership powerhouse from the minute I started looking into memberships. They are all functioning well. So I'll just read them off. Region 4 FSS Advisory Council. In the Bronx, we have the Bronx, the Brooklyn. I guess it just looks like one council for each borough. So there you have that. Could I have the next slide, please? So Region 5 is made up entirely of Long Island with the counties of Nassau and Suffolk. We've heard Mary raise some concerns about membership and I think importantly participation on the council. And Mary, of course, is anytime that you're interested in talking about some strategies to try to help you guys move that along, reach out, let me know, and we can definitely work on all of that. So now we're 13 councils. Our bylaws allow for a minimum of 13, so we have more than enough room to consolidate should we need to complete this phase of rebuilding the network of local councils. I'm just going to add here that a number of local councils have reached out on their own to some of the almost 150 new member prospects that we were able to connect with and qualify through our work related to the needs analysis survey that we completed earlier this year. Bringing on new active members who can commit the time and energy to do this work is not easy. So I want to commend all of the local councils for the work they've done on their own with their prospects from the survey and through other channels.
Thank you, Chris, for your hard work on that too.
Certainly. So several councils have increased their membership or are currently in the process of onboarding new members. Now I've done that. So, okay, so keep going. Going forward, once we are fully functional across the state, we'll be engaging in targeted outreach to further develop our membership based on individual local councils' needs and desires, and we'll be putting a strategy in place for that. Of course, if anyone's interested on today's WebEx in joining us, it's important work. We've set up a general mailbox, and if I could have the next slide, please. We set up a general mailbox to handle your inquiries on this or other matters that you'd like to bring to the statewide FSS committee. So if you do have items that you'd like to bring up to the committee, if you're interested in joining us in this work, or if you're just interested in finding out a little bit more information about what joining our council might entail, we do have materials that you can review and go through to try to better understand that. Please don't hesitate to reach out to us. It's statewidefss@gmail.com. Thank you.
Thank you, Chris. You've done a tremendous amount of work helping organize all of these efforts, and it did not go unnoticed. You're once again a great champion and advocate for statewide FSS. Thank you so much for all your work in this area.
Thank you.
Okay. That brings us, believe it or not, even though we never followed a single item on the agenda.
It's 6 o'clock in the morning.
Time, we are right where we intended to be. We're actually 5 minutes ahead of schedule somehow. Public comment was scheduled to begin at 1:55. It is now 1:50. Unless there's any other unaddressed business, we are ready to move into public comment.
Excuse me, Gail, sorry to interrupt. How does Christopher sign in to speak for public?
So Colleen is going to lead us through public comment, so she will be going through the process and she'll let you know how to do that. And just to remind folks, we will not be responding to public comment. We will be listening and taking notes. If there's additional follow-up needed, we will ask for additional information from you to connect you to the regional field office. Thank you.
All right, just bear with me one second. Okay. Okay, so the first one I have is Christine. Christine, I'm going to unmute you, and just a reminder, you have 3 minutes. I'll start the clock. So I've sent you a request to unmute. Okay, you're.
Everybody hear me? Can anybody hear me?
Yep, we can hear you.
Okay. I am a CDPAP home health aide for my son. I did quit my career as a award-winning Emmy and Grammy editor for Mariah Carey and Michael Jackson, and my son got sick, and there was no other option. I was going to lose my house if I didn't become a CDPAP person. So I don't understand why, you know, CDPAP is not allowed. And the second thing is, if people that can get this family reimbursed respite can get other services that are not respite services, like legal aid for special needs trust. What does that have to do with respite? But I'm not allowed to get that because I'm a CDPAP person. So there's other services that family reimbursed respite provides that don't really have to do with respite, and I'm being denied of those services for my son. So that is my little pet peeve, and if somebody wants to take the last remaining minute, that would be fine.
Thank you for your comment, Christine. Okay, and I apologize. I meant to go around the state locations, the remote locations first. So we'll start with New York City. So you can go ahead if you have anybody in the room, you can go ahead now.
Yes, Christopher Grice, go ahead.
Before I start, can you guys hear me? I only hear mumbling, so can you repeat that?
We can hear you.
Okay. Good afternoon. I'm Christopher D. Grice. As an advocate for people with disability for over 30 years, it's nice to see that we're getting a lot of things, some things getting done. But I'm going to remind you again and again, I'm glad we have individuals, self-advocacies, parents, but it would be nice to hear from more services, more things to be coming through. Every year, when it comes July, is Disability Prime Month. It would be nice to see every staff from Albany to go around the New York region, and as we celebrate Disability Prime Month, which is a very important holiday, because ADA was created almost 34 years ago. I hope to see you guys coming around. Nice to see you doing it upstate. Thank you. But down the south, down the borough island of Long Island, down to the 5 boroughs, as well as Westchester, we need to see you guys coming down. And I hope to see everyone come down because I know we like to celebrate Disability Prime Month and see a lot of more things. We hope to see a lot of you guys come to when there's family support fairs. We're glad to see OPD staff do show up, but we like to see sometimes the bosses to come out. A lot of excuses, a lot of saying, I can't make it. You guys have a lot of staff up there. It's called like the Three Stooges, spread out. And let's get something done. And when we email you guys, can we please get faster response and communication? Because right now the communication is down very much. Everyone, happy Disability Prime Month. Let's remember what things we accomplished and what things we can still accomplish in the near future. Thank you. This is Chris Grice, the only speaker for New York City, live, as well as representing Brooklyn, New York, where we don't sleep.
Thank you for your comment, Chris. Okay, next we'll move to the Buffalo location. Is there anybody in the room in Buffalo that would like to make a public comment?
No, I believe not.
Thank you. Okay, and I don't believe we have anybody in the room here in Albany that would make a
public comments, so we'll move down to our list of attendees. Next on our list is Jacqueline Tripodi. And Jacqueline, you're unmuted. You can go ahead.
Thank you. Oh, I only see 48 seconds. I want more than that. There we go, 3 minutes. I'm Jackie Tripodi. I am the parent of a 31-year-old with multiple disabilities. I'm also with a family support agency that provides reimbursement. So I'm going to touch very quickly. I put some information in the chat, questions that we can pay for individualized basketball programs, because we could do for piano, we could do for swimming. I don't see why we can't do that. You mentioned simplifying the tracker and the application, the directions, and your FAQ and your allowable, non-allowable list. I need to remind everybody that our fiscal year ends in 18 days. So when are you implementing this? We need to know this information. You mentioned CDPAP. You talked about having this families based on income. That is a disservice and disrespectful to those families who have a hard enough time finding someone to care for their child. So no, you shouldn't use it based on income. You should do it based on the fact that this is what the child needs. There are no FSS respite programs in downstate because those were all waiverized. So our children who are getting eligibility down here are not getting waiver services. They have no options to get reimbursed, to get into a program. When we try to do the reimbursement, these poor families have to jump through hoops. It's hard enough for them. This is a family support program. Let's support the families. The other thing is, I'm going to echo what I heard somebody say earlier. My kid, a museum, it's lost. Maybe you take him to the zoo. It's something that's going to benefit him and get him in the community. Let's get that straightened out, shall we? And I know that you guys are working on it, but you need to work a little faster because agencies are put on time frames to get things done in a timely manner. Well, OPWDD, we need you to do the same. Thank you for the opportunity to speak. Oh, one more thing, safety and well-being. We have somebody who wanted a blender, but you said no, the kid's on a G-tube and family can't afford to keep buying the blender that they need to do this. Medicaid's not covering it. And even with the Medicaid denial, it's on your non-allowable list. Please look at that. Let's help these families who really need the help. And I did it all within my time frame. Have a very nice day.
Thank you for your comment, Jacqueline. Next is Bob Castro, and I apologize if I'm mispronouncing that. You should have received a request to unmute, so you can go ahead and unmute. There you go.
Can you hear me?
Yep, we can hear you.
Okay, good. When you had brought up CDPAP earlier, and again, this is not for everybody, but would there be a way within our own waiver to have CDPAP as an alternative for respite, or exploring that? Because if we were able to do that and families able to utilize that, obviously you would capture federal dollar, but also you would potentially open it up for more families to use family support dollars, which many of the families using family support dollars have no other recourse. So as CDPAP is being brought up, it might be consideration to think about. And that's all I had to bring up.
Thank you for your comment. Okay, next is Kate Hoy. Okay, you're unmuted. Go ahead, Kate.
Yeah, thank you so much. I really appreciate everything that everyone has said, and
Chris, back at you out here in Brooklyn. And happy Disability Pride Month, everyone. I really just wanted to endorse the comment about putting information on the website about the councils. Thanks for all the good information that's there now. We have the pleasure of working with so many families here in, pardon me, New York City. And I'm getting calls and emails all at the same time. Apologies. And they would love, many are very interested in joining the council. They know that it's not paid. The truth is, of course, the families that we work with in our specific program are under 21 and live at home, of course. So, families have a lot to do and a lot of responsibilities. But if we could help them get more information on their own, in their own way, at their own time, that would help many of them. Because when we say, do you want to talk to a council member? They say, oh gosh, I'm not ready to do that yet. So I just really wanted to endorse that if there was more information available for them in their own time that we could perhaps even help them access, that would be really great. Secondly, I would just ask again, the administrative burden that is coming up for us. We love what we do. We're really very, very meticulous, but with self-direction and the DPP forms, we're getting all different kinds of forms from different providers. We love our contacts at OPWD and the self-direction unit, but there are other FSS programs that have, for crisis or New York Start, that not an FSS program, but crisis and home crisis support that do not have to be on the budget. We've had this conversation, and it delays families' ability to access services quickly and as needed. It has gotten better, but we already do Form 3, so completing the DPP as well. Our service is really quite unique. It's as needed. It's not ever the family's fault if the DOE chooses not to do something, even when they have a lot of evidence that they should, or there's ongoing conversations and negotiations, and it just, anyway, there's an issue there. We want families to access FSS services as needed as soon as possible. There should be some differentiation for different service types and modalities as to whether or not they need to also then be on the budget or do the DPP forms. I would also say that families are very confused, and we're really so thankful for all the council members and also our local FSS coordinators who have been so compassionate and supportive of families who are really confused when they're not getting the waiver. There just needs to be more information for families about what to do next. A lot of families don't have the support of the CCO, and I feel like they're in no man's land. And so more information is needed to support those families and help them access FSS sooner. Thanks.
Thank you for your comment. Okay, at this time, I don't see any other hands raised. Is there anybody else that was interested in making a public comment? If you would click the raise hand icon to indicate that you'd like to make a comment. Okay, we do have now Diane Shannon. I just sent you a request to unmute, so you can go ahead and unmute. Sorry, Diane, I saw you came off mute, and then went back on mute, so there you go.
Can you hear me?
Yep, we can hear you now.
So we have a 35-year-old son who has multiple disabilities and has severe IDD. And my husband is in his mid-70s. I'm in my late 60s, and we've been looking for housing. So this week I tried to apply for a HUD house in Westchester, 2-bedroom, and he has the funds to buy the house because he's got a special needs trust. But it was a 2-bedroom, so he could be there with an aide. They refused to take the application because there would be an aide living there. They wanted the aide's income. Well, I don't even know who the aide would be at this current time. And they said, well, yes, it's unfair, but that's too bad. So there's really no certified settings in the near term. And we're just really can't figure out, we'd like something in place before we die. And I'm just don't know what to do. I feel like every avenue we go to, it's closed. And what do they care whether there's an aide there? That's one. The other is, why is the housing subsidy higher in Rockland County than there is in Westchester? Westchester costs more money to live in than Rockland County, so that makes no sense. And then my son gets self-direction, and the IDGS line has not had any increase. He's been on for 10 years. It's not been increased. It's stuck at that 32,000. Meanwhile, prices have risen, and you've increased, which is great, the staffing lines, but the other lines in the budget haven't increased. And that's all I have to say. Thank you.
Thank you for your comment. Okay, I don't see any other hands raised. I'll give another minute to see if anybody else raises their hand to speak. Buffalo came off mute. Did you have something else in the Buffalo location?
I have a quick comment going back to the recruitment program. If I could have 30 seconds. So, I mean, it makes a lot of sense to try to enhance and improve click-through rates. We have 14,000 click-throughs. That's a lot of potential, right? So it makes a lot of sense, of course, to try to boost those click-through rates. And while we're doing that, to try to increase our ability to do it efficiently, right? That's great. But in thinking about the project, right, it's really not just, one conversion, one click-through. It's kind of a funnel, right? You have the biggest number of people, the click-through, fewer people, what's the next conversion? Fill out an application maybe. And then you're going to have fewer people still who are doing the conversion that's going to ring the bell. And that's hiring someone, right? So I understand that some of this is happening privately in agencies, and it's being driven by OPWD, and there's collaboration that's going on within all of that. But I just want to say that if we're not measuring those secondary conversions that lead to the hiring, and if we're not looking at those conversions and try to understand what we can do to try to increase the frequency of those conversions and the quality of those conversions while this process is going on, since we're investing so much money in it, if we're not engaging in those efforts along with just trying to boost click-throughs, then we are leaving ROI on the table. And that is just something that we really need to try to focus on not doing. And so that was my comment. I thank you.
Okay, so I don't see that anybody else's hand is raised. So that completes the public comment period. So I'll turn it back over to Gail. Okay, well, that concludes the June 12th Statewide Family Support Services meeting. We thank you all for attending. Our next meeting is on it's September 25th. So tune in for more updates and exciting news from Statewide FSS. Thank you, everyone.